This workshop is the first ever to address in a formal, systematic way periodontal diseases and conditions in children and adolescents. And it's been particularly challenging, I think it's fair to say, because there is a lot of literature that's not been reviewed before. So one of the challenges that my group's faced in Group 1, and this is a group that's looking at systemic diseases and conditions that either present within or impact upon the periodontal tissues, is the definitions of things like genetic versus developmental versus congenital versus hereditary. Simple stuff, but when you review the literature, then it's important that we are all using the correct definitions and terms. So maybe I could turn to you, Mariano, and Group 2. And from a scientific perspective, we're interested to know really the challenges you've faced in Group 2.
Yes, indeed. I mean, we are covering gingival diseases in healthy children and adolescents. And the main challenge is that children are very different to adolescents, mainly in the structural organization of the gingival and periodontal tissues. And while in children, periodontal inflammation is highly prevalent, we cannot relate it to the periodontal attachment because the periodontal attachment is still forming. So we cannot really use our main diagnostic tool, which is the periodontal probe, in children before the age of 12. Therefore, I think this workshop is a unique opportunity to really make some recommendations and guidance on how to evaluate and manage gingival tissues according to the different developmental stages of children. The consensus reports will be useful for not only pediatric dentists and periodontists, but also for general dentists in the overall appraisal of children and adolescents in terms of gingival diseases, of course.
So you're leading Group 3. Do you want to share with us the scope of what you're doing and the challenges scientifically that you're facing?
The literature that we found was not so much as it was in the other groups, in your Group 2. And the quality was not it was low, if I can say, because it was mainly based on case reports on specific populations and with a so big heterogeneity among the criteria used and the way that they can diagnose the periodontal disease. Also, as far as it concerns the periodontal treatment, is something that we discussed a lot about the phase 1, about the stage 2, as you say that. And we see that many things can be done in children, but we have to take into consideration the needs and the family environment and also the child's collaboration with all this. And we need to make a plan which is also pragmatic. I know it's not easy always, but we have to reach that point that it's going to be for the benefit of, in general, of the person.
So make sure you read the consensus report when it's published, because it's going to be insightful, it's going to be hopefully relevant, very relevant clinically, but it will also importantly point to future directions for research, because there is a huge amount of research that we need to do, and we need to do it collaboratively with our pediatric colleagues from a periodontal perspective as well.
Absolutely.